So this is Introduction to Government Benefits and Special Needs Trusts. I'm Michelle Wolf, the Executive Director, and I'm joined here by Alexandra Oatman, our Director of Marketing and Outreach. So we're going to be covering uh, some key government benefits, federal and state, not every government benefit, but just the ones that are most important to people with disabilities, and then get into if you want to keep those benefits, why you might need a special needs trust. Then talk about a subcategory of special needs trust called pooled special needs trust, and then getting a little digging down even more, talking about our pooled trust, which is called JLA trust. And then at the end, we'll cover a little bit about CalABLE savings accounts, which are offered through the state of California Treasurer's Office and are available online. So, what is the main problem that we're trying to solve here? How can someone with disabilities obtain and keep as many government benefits as possible and also be able to get money from typically a legal settlement or an inheritance? And so sometimes those inheritances are planned, they're planned ahead of time, and sometimes a family member dies and the person inherits, but there's no special needs trust that's been set up. So planned and unplanned inheritances are treated a little differently under the law that we'll talk about. So the big picture with government benefits
Too much
is, if you could mute yourselves, please. So, and then I'll stop the presentation and we'll have a chance to chat and you can certainly put your questions into the chat box while I'm presenting. Many government benefit programs have both asset limits, sometimes that's called a resource, and income. And income, it means what money you receive monthly, along with disability criteria. And so you could be quite disabled and still not qualify for government benefits if you have too much money in your bank account or you're receiving too much money on a monthly basis. So, and for many of the programs, you have to meet all three criteria: the disability criteria, the monthly income, and then the asset. So, government benefits are super important and vital for our population, but they're really only designed to get you barely to the poverty level. That's because many of them were created in the mid 70s and have not really been updated to meet today's needs in terms of how much things cost. So in 2025, the federal poverty level for one person is only $14,580. Whoops. And for a family of four, it's 30,000. So clearly that's not enough to live on anywhere in Southern California or pretty much around the state. So even if you get and keep your government benefits, to have a decent life, you will need to supplement it. And that's where the family inheritance can come in. So on the left-hand side, we see which benefits depend on your income level. So that's going to be SSI, supplemental security income. That's different than Social Security retirement. SSI is for people with disabilities who have not been able to work very much, or older people over 65 who have not been able to earn all the quarters they would need to qualify for retirement. And then we have Medi-Cal in California. That is California's Medicaid plan. So we're hearing a lot about potential cuts to Medicaid. Here in California, in our mind, we need to remember that when we hear Medicaid, really that can impact Medi-Cal in California. So Medicaid is a combination of federal money from Washington, D.C., and then there's state money here from the state of California. On the right-hand side are benefits that you're entitled to regardless of your income. So SSDI, Social Security Disability Insurance, if you've been working for a while and you become disabled, then you would qualify for SSDI. And then, as I'll show you in the next slide, you can also get SSDI. An adult child with disability can get SSDI from their parents' earnings, their parents' work records. And then I think most of us know that anyone over 65 who's a citizen in the US qualifies for Medicare. But there are younger people with disabilities who also qualify for Medicare. Anyone who receives Social Security Disability Insurance, SSDI, for 24 continuous months then qualifies for Medicare. So many of our clients who are in their 50s and 60s with disabilities actually have all four of these benefits. So I always say if you are eligible for a benefit, you should apply for it and you should try to keep that benefit. So this is a very important benefit that a lot of people don't know about. It's through the Social Security Administration in Washington, D.C., and it's based on a parent's earnings. So if a parent has a child with a disability, that adult child can receive a percentage of the parent's benefits. If the child was diagnosed before the age of 22, and that child is now over the age of 18. So let's take little Johnny. Johnny was diagnosed, let's say, with autism at age 3, and Johnny is now 25 years old. Johnny's dad, Paul, has been working and retired at age 70. Paul is now getting his Social Security retirement, and Johnny can receive 50% of whatever Paul is getting. So let's say Paul is getting $1,200 in his Social Security retirement, then Johnny would be able to get 600 of that under this disabled adult child benefit. And then after Paul passes away, Johnny can get 75% of what his father Paul was getting. So in my example, that would be $900. You can only collect from one parent, and it can be from a divorced parent as well. Okay, now we're going to hit very briefly what is SSI, Supplemental Security Income. This is a monthly cash benefit. Most people max out at $1,206 a month. Most of it is from the federal government, and then 239 is from the state of California. Most other states do not supplement, so it's unusual here in California. And again, that's for people who are disabled and have not been able to work under the age of 65, or people over the age of 65 who have not been able to work. And this is the big kicker: you're only allowed to have $2,000 in the bank or $2,000 in any form of countable assets. So that could be checking account, savings account, stocks, bonds, Bitcoin, gold bricks, gift cards, anything you could easily turn into cash. So you're only allowed $2,000 at any one time. This is a very outdated amount, but it has not been changed. And frankly, given the current administration, we don't see that change coming anytime soon. It links automatically to Medi-Cal. So you only need to be receiving $1 a month of SSI, and you'll keep getting Medi-Cal. So what are you allowed to have and qualify for SSI? So there's a pretty nice list. You can have one house that you live in. It can't be just a rental property that is exclusively rented out. The person with the disability has to be living in this residence. You can have at least one car. You can have small life insurance policies and burial plots, and you can have household goods and effects. But again, you're not allowed to have more than $2,000 in the bank or in stocks or in bonds or any kind of investment vehicle. The limit is $3,000 for a married couple, or $3,000 for parents of a minor child under the age of 18. So, how does this SSI, the Social Security Administration, define income? So, there's two kinds of income. There's unearned income. So that's like interest. Money's in the bank and it's earning some interest. It can also be things like alimony support, pensions, dividends, rent, if you're renting out a room or part of your house. Um, so all of that is unearned income. And you get your SSI monthly check reduced dollar for dollar after the first $20. Now, earned income is treated much better. That's if you go to work. Either you work for somebody else, or you're self-employed, or you do some gig work. Any kind of work would fall under earned income. And after the first $65, you lose $1 for every $2. So you can work and you can have SSI and work, and you will come out ahead doing that. So there's a myth that you cannot work and receive SSI, but there is a limit on how much you can receive. But as we'll see at the very end of the presentation, there's a way around that limit with the CalABLE accounts. So SSI has this very old and completely outdated rule, and that's called in-kind services and maintenance, ISM. So basically, the federal government is saying if somebody else, including your special needs trust, pays for your mortgage payments, property taxes, rent's gotten a lot better under some new rules, heating, fuel, gas, electricity, water, sewer, or garbage removal. The federal government says you don't need as much money as we were giving you before. We're going to reduce your federal amount by 1/3 plus $20. So in 2025, the amount that you would lose is $342. So it used to be that food was included in this ISM rule, but that has changed as of October 1st of last year. So somebody else can pay for your food when you get SSI, and there's no penalties. So that's great. And then the rent subsidy is changing. So basically, as long as you're paying rent over $342 a month, and you have an actual business arrangement, you have a lease, even if it's with your parents in the family home that you grew up in, you will not get that 1/3 deduction in ISF. All right, we'll talk a little bit about Medi-Cal and in-home services, and then I'll pause to get your questions. So what is Medi-Cal? Remember, that's California's Medicaid health insurance program for poor, disabled, and seniors. It pays for a wide variety of medical care, in-home caregiving, and also long-term care, like in a nursing home. It can pay for things like wheelchairs and insulin pumps, and it can pay for prescription medications as long as the medication is on the state's list of approved medications. That's called a formulary. And it can also pay for end of life. You can have both Medi-Cal and Medicare. You can even have Medi-Cal, Medicare, and private insurance, like from an employer. Medi-Cal pays a pretty low provider reimbursement rate, so it's always going to be the last payer of resort. And then a super important program of Medi-Cal in California is IHSS, in-home supportive services. This allows people with high needs to stay in their home instead of having to go into a nursing facility. And right now, it pays an hourly rate to the caregiver that the person chooses, which could be a family member. In LA County, that rate is now $18 an hour. And around the state, it varies. But the very lowest it is 16, and I think the highest in San Francisco is 19 or $20 an hour. The County Department of Social Services comes into the house, does an assessment. They're going to be looking at the activities of daily living, very basic stuff. Like, can the person get out of bed by themselves? Can they go to the bathroom by themselves? Can they get dressed by themselves? Can they prepare food by themselves? Can they give themselves medicine? So we're looking at fairly basic everyday living skills. And as I mentioned, family members can be paid care providers. The family members can be living in the same household or they can be living elsewhere. The maximum you can get is 283 hours a month, which works out to 8 or 9 hours a day, depending on how many days there are in that particular month. So over time, benefits change. This chart is particularly pertinent to people who are receiving regional center services. So regional center services are for people with autism, cerebral palsy, um, intellectual disability, or severe epilepsy, or a similar condition. And children can get on like very young or even at birth, and that can go all the way through through their entire life. And then once the parent retires, as I mentioned before, there are benefits that are available with that childhood disability benefit. And then that would change once the parent passes away. And Medicare kicks in 24 months after getting that childhood disability benefit, which comes in technically under SSDI. Oh, and one way to know if you're getting SSI or SSDI, if you get your money from the government on the first day of the month, you're getting SSI. If you receive money on the third day of the month, you're getting SSDI. And many people have a combination. Usually that combination comes in on the third day of the month. And then just as a quick aside, people who receive SSI and in-home supportive services are also eligible for food stamps. In California, we call that program CalFresh. So you can earn a little more and still get food stamps in California, up to 200% of the federal poverty level, and you can apply over the phone, in person, or online. You'll get an EBT, looks like a credit card, that's loaded monthly. Most people aren't getting very much, somewhere between $100 and $200 a month. The average is around 130. If an adult disabled child is living at home with their parents or siblings, they have to be over the age of 22 to apply. And also, yeah, very important, the Medi-Cal asset has been removed as of 2020, actually completely removed as of 2024. But there's still monthly limits to how much you can earn. All right, I'm going to stop here for a minute and see if there's any questions.
There are a few. So the first one is how do taxes work for adults with disabilities?
Well, it depends what the income is. So, I mean, if they're earning work, if they go to work at McDonald's, they would be taxed the same as anybody who works at McDonald's. SSI income is not taxable. SSDI income is not taxable under a certain limit. I think it's around $1,200 a month. And after that, there is a taxable portion.
Um, so for a question about SSDI, if the parent is disabled but still working part-time, does the adult child still get benefits?
The parent has to be receiving Social Security retirement, or the parent could be receiving SSI themselves. And I guess
Uh,
even in some cases, this sounds like the parent might be getting SSDI. So if that's the case, yes, the adult child would be able to receive this benefit, but there is a household limit. Um, I think it's around $4,000 a month. Uh, there's a household limit on how much total can be received under SSDI.
how do I navigate work for my son's hours, wages when he cannot make more than 1,600?
So, Dolly, the answer is going to be to put his earnings into the CalABLE account, which I'll talk about at the end. But I'll also go ahead and put the URL in chat. So, if his income is earned income goes right into a able account, he can earn up to, I think it's 37,000. Might even be 39,000 for the year. If Medicaid benefits change with this current administration, Medi-Cal would be affected. That's a complex answer. We don't know. So if the feds take away some of the benefits or they add additional requirements, what we don't know is how the state of California will respond. So California, because California is already giving into the system, the impacts in California will probably be less than in a lot of other states. Like I know there's states like Arkansas and Mississippi where the states don't contribute any money. And those states, it'll be pretty severe what happens to adults with disabilities. But we're hoping things will be less severe here in California. Okay, I think I'll jump back in. And I'm not sure what happened. Uh, Hang on a second. I think new uh, my new slide that I did with the new news didn't make it in. Hang on just one second. Here. Let me see if I can get this to work. I'm going to stop that share and then open this up. All right. So, uh, I'm not sure. I did a brand new slide about what's happening with the changes in the Social Security Administration. So I'll just share it. What's happening is if you used to use the phone to verify your identification with the Social Security Administration, that has changed, and you now have to verify your identification either online or going into a field office. But if you're applying for SSI or SSDI for the first time, you can still do that on the phone. So those changes are coming April 14th. And then in terms of field offices being closed down, so far in California, there's no closure of offices. So that's the most up-to-date news. How to keep benefits. So one really good way to keep benefits is to use a special needs trust, which I'm abbreviating as an SNT. So they're a legal mechanism so that a person with disability can hold on to some assets, have a high quality of life, while at the same time keeping eligibility for government benefits, like we just discussed. SSI, Medi-Cal, in-home supportive services, and food stamps. Money in the trust has to be used for the benefit of the beneficiary. So once there's money in that special needs trust, you can't take it out and use it for grandma's cancer treatment. It has to be used for the beneficiary. And then it also has to be irrevocable. So that means you can't easily break it or change it. It has to be irrevocable. But the good news is S&Ts let the beneficiary have all the benefits of those government needs-based programs, plus being able to request their assets, plus they can get investment income. So there's two major types of special needs trust. There's the first party. So what happens is if somebody, the best example of this is in a legal settlement. So somebody has had a lifelong disability and they've been living on SSI and Medi-Cal. They get a bad car accident. They get $50,000 from car insurance. If they just keep that $50,000 in their bank account, that's going to stop their SSI and also will stop their Medi-Cal that's linked to the SSI. They could actually get another form of Medi-Cal, but they might have to pay more. But if they go ahead and park that $50,000 in a first party special needs trust, they can keep getting SSI and keep getting that same form of Medi-Cal. But there is a Medi-Cal payback after death with the first part. Now, uh, and also the same also holds true if there's an unplanned inheritance. Grandma passes away, and she says in her will, I want to divide my estate equally in four parts to my four grandchildren. One of the grandchildren happens to be a regional center client with autism who's getting SSI and Medi-Cal. So if that, let's say that person is not a minor, that person is 25. If that 25-year-old regional center client just keeps his share of the inheritance, they could lose their SSI. But if they go ahead and put it in a first party special needs trust, they will be able to keep their SSI. So what parents and grandparents need to do is plan ahead, and in their own family trust or in their wills, they need to say, I am leaving money for my grandchild, Justin. I'm leaving it to Justin's special needs trust, not to Justin. So the special needs trust is its own legal entity. And that way, Justin can keep getting all of his benefits uninterrupted. So the best practice in the field when you set up a special needs trust is to use a professional trustee. Sometimes those are called corporate trustees. Sometimes they're called a licensed fiduciary. This is what wealthy families have been doing for a long time. They use banks or their law firms or a commercial trust company. The problem with all of those professionals, they don't really want to talk to you unless you have $1 million in that special needs trust. So what do the rest of us do? So typically more middle class families have named a sibling of the person with a disability. But asking a sibling to take on that role as trustee, that could be a big burden because as we can see, these benefits are complicated, they change a lot, there's tax implications, and plus, there's just an ongoing relationship which could be strained by having to make financial decisions for a sibling. For those of you who are regional center families, the reasons why you might want to plan ahead now is because even though regional centers are great and can provide a lot of services, by state law, regional centers cannot pay for rent. So in a group home situation, the regional centers use SSI or SSDI for the payment. So it's super important for parents of regional center clients to plan ahead and to put a special needs trust into their will or into their own family living trust. You don't want to make everybody scramble after you pass away. It creates a double burden for families. So what is the solution for middle class families? Well, it's something called a pooled trust, also known as a D4C. They were created by Congress in 1993. They're required to be run by nonprofits. Each nonprofit has a master trust that governs all the participants. That master trust acts as like an umbrella for all the beneficiaries. And then everybody signs up by signing a simple joinder agreement. And then a separate account is maintained for each beneficiary. Um, but we only pool the money together for investment purposes. And so right now we are up to around 13.2 million in total pooled assets. So that really helps to leverage the money. So a pool trust might be a good option for you and your family because there's cheaper setup fees. If you go to a private trust attorney, they'll charge you at least $3,000 to set this up. And our setup fees are a lot cheaper. And also, pool trusts are the only option available under the law for someone over the age of 65. And as I mentioned, it can really minimize conflicts of interest from family members and spouses. So, what do we offer? So, we have active and inactive options. So if somebody gets like in a car accident, as I was describing, let's say they're 30 years old, they're on SSI and Medi-Cal and food stamps, they're getting $50,000 from a car accident. Their only option is to use this first party active special needs trust, and that has a $1,300 enrollment fee that covers the first 12 months of service. And you'll want to spend down the money while that person is alive, because otherwise Medi-Cal will come calling after the person passes and say, hey, we let you keep all your benefits, even though you had $50,000 in a special needs trust. Now we'd like to be paid back. For parents who want to plan ahead, you can have an active account that requires at least $20,000. And that has that same $1,300 fee. But for most families, the best option to plan ahead is going to be our future funded option. And so that is only a $600 enrollment fee plus a $200 deposit. So we don't charge any annual fees until it's funded at the $20,000 level. So some people say, well, once the money is in the trust, what can I use it for? So it's very wide ranging. It's almost anything that's legal that improves wellness, optimizes independence and inclusion, and enhances your quality of life. So lots of our clients are using their trust money to buy and pay for their monthly cell phone plan, their internet, their streaming channels, um, clothes and shoes, especially if you have specialized equipment, all kinds of home furnishings, all kinds of electronic equipment, including computers, laptops. Um, and if you needed a special computer for work you were doing from home, that could be purchased with a special needs trust. And then any medical, dental, um, or medical related expenses that are not covered by any other health insurance, trips and vacations. And we can pay for one aid if that aid is needed for either those activities of daily living or behavioral issues. Also, in-home help to supplement your IHSS hours. And trust money can also be used to buy a car or a residence. But just because houses cost so much in California, it's been tough for that to happen. We have a partnership with a financial services company called TrueLink Financial Services based in San Francisco. And they're the ones actually managing the money. And the money, all of our 13 million is at Charles Schwab in different investment accounts, and TrueLink is managing and picking the stocks and bonds that are in those investment accounts. We are required to be very conservative in our investing. We have to follow something called the Uniform Prudent Investor Act. So there's nothing speculative. And disbursements can be requested online, by text, or by phone. and we use a reloadable prepaid restricted use Visa debit card so people can pay for their expenses out in the community. Why don't I pause here and then we'll get into CalABLE. Oh, I didn't do the right URL for CalABLE. I got two L's in there. Sorry. It's CalABLE.org.
Oh, yeah. So an adult child cannot apply for SSDI until the parent is retired. Is that true?
That is true. Unless that adult child was working sufficient quarters and then became disabled.
Um, I don't understand how an inheritance can go into a first party trust because it's not earned income or a legal settlement.
So the reason why it becomes unearned income. So if the parent, where's Karen? If the parent or grandparent didn't set up the special needs trust before they passed away, and like I said, like the grandchild in my example, if that grandchild just inherits money, that's going to be considered unearned income. They're just getting a lump sum of money. So that $50,000, let's say, could throw them over the $2,000 SSI limit unless they put it into a special needs trust.
What happens if the market crashes? Same as everyone else, we lose it all, right? What happened to this trust during 2008?
So people's investments definitely went down, but our conservative portfolio is only 20% equity and 75% fixed. So it's bonds, and it's a mix of uh, corporate, uh, federal, and local bonds. So what I'll typically what happens when the stock market crashes, the bond market goes up. So anyway, these accounts typically don't see not that much huge increases or decreases because it's very conservative portfolios, but they can go down. They can certainly they can certainly decrease during a down period.
How does a conservatorship impact government benefits and vice versa?
So it's a good question. So conservatorships are very different than trusts. So trusts are all about money. Who is controlling the money? Who has oversight of the money? Whereas conservatorship is really making and guardianship. You might heard that term too. That's making decisions, life decisions. Where is the person with a disability going to live? Where will that person with a disability be able to sign contracts? Will the person with a disability be able to get married? Which social contacts can the person with disability have? So those are the kinds of issues that are covered under conservatorship. And in California, we have something called a limited DD conservatorship. And there's 7 different powers. I'll put that. And that's like the ability to sign contracts, the ability to decide where to live, the ability to decide where to go to school, ability to get married, social, sexual contacts. That's all covered under a conservatorship. So the only difference would be is if someone is over the age of 18, only that person can go and ask for benefits. If they're conserved, then the person who conserved them, the conservator, can go online and apply and interact with the government officials. The only other way that somebody else could could apply on their behalf would be to become either a power of attorney or a representative payee. So the issue of conservatorship, again, it's about making decisions and who can interact with the government authorities and who can interact also with medical personnel. So if you're over the age of 18, you're automatically, it doesn't matter what your disability is, you're considered to be the main person to talk to medical or government authorities. If you're conserved, then it would be the conservator's role. If there's a power of attorney, depending on what the power of attorney is granted, which powers, that power of attorney agent would be the one interacting with the medical and the government authorities.
Can different relatives deposit funds into a third-party special needs trust?
Yes, yes. So once the trust has been established, other people can um, definitely deposit money. And the Cal with the CalABLE accounts that I'm going to talk about in just a minute, it's even easier for other family members to deposit funds. And the thing about CalABLE and Special Needs Trust is money can move from one to the other without any penalties. So basically, we recommend people have both a CalABLE account and a special needs trust.
All right.
Uh,
Oh, wait. Can there be multiple special needs trusts? What if an aunt creates one, then my mother, then me?
yeah, so yeah, the aunt could definitely create a special needs trust as part of her estate plan. And then you would create the CalABLE, which is not a special needs trust. So let me go into the slides with the CalABLE, because with the CalABLE accounts, there's no trustee. There's the technical term is there's no fiduciary. So there's no third party, there's no outside party that can say yes or no to spending the funds. If the person is conserved, again, that would be the conservator's role. If the person is not conserved, that is not the case. So CalABLE is part of the national ABLE movement. The ABLE accounts were created back in the Obama administration, and they're now available in every state. California has created its own through the California State Treasurer's Office, and it's called CalABLE. So before the ABLE Act, remember we said you were only allowed to have $2,000. Now you can save up to 19,000 in any one calendar year, and then over 6 years you could have up to 100,000 before your SSI is impacted. Um, they are tax advantaged government accounts. They are not, they're similar to the 529 savings accounts. Let's see. I don't know where I'm stuck. So, in order to set up a CalABLE account, the disabling condition must have been diagnosed by a medical person before age 26. So that's hard for a lot of our young adults who got diagnosed with mental illness in their um, late 20s, which happens quite a bit, or even early 30s. But the age limit is going to increase to 46 next year. You're only allowed one ABLE account per social security number. The beneficiary is the account owner. And then you can open the account online. Either the beneficiary can do it or any of these authorized legal representatives. So if it's someone under the age of 18, it could be a parent. Over the age of 18, it could be the conservator, the power of attorney, or the rep payee. And as I was saying, accounts are asset protected. And you can spend it pretty much on the same things you can spend a special needs trust, including food, education, rent. So if your rent is on the low side, you can use your ABLE account to pay for rent, and then you won't have that SSI ISM deduction. You can also use it for any kinds of transportation or healthcare expenses. So the thing about CalABLE is you can only sign up online. You cannot go into banks or any financial institution. And to sign up, you have to have the date of birth, address, and social security number of the people on the account. It has to be linked to an existing bank account. And this is the full link to sign up. And as I was saying, experts are saying that people with disabilities should have both an ABLE account and a special needs trust. Um, ABLE accounts allow people to have more control over their own money. There's advantages for paying for rent. It's also if somebody is earning more than $1,600 a month in earned income, you can you can put the person's wages into the ABLE account. And like I said, you can transfer money from a special needs trust to an ABLE account. Um, and then the only thing is ABLE accounts do max out at 100,000 for SSI. And even though 100,000 is that's a lot of money, that's probably not going to be enough for a 30-year-old over their whole lifetime. If that 30-year-old has pretty severe or even moderate disabilities. So that's why you still would want a special needs trust to have additional dollars beyond that 100,000. So the
There's
big pic,
also
go
more
ahead.
financial oversight with a special needs trust.
Yes, much more financial oversight.
Yes.
Um, so uh, you have to have a checking account to be able to get your monthly SSI or SSDI checks, also to put in your earned work earnings if they're on the lower side. Then a CalABLE account when you're receiving higher work earnings and when you're getting larger gifts from family members. And then that third party special needs trust, that becomes kind of like a retirement nest egg. That's for the larger amounts of money. And that is certainly for when the beneficiary is older and is likely to need money, mostly for in home help to be able to stay in their own home. So I know that was a lot. Um, our website has lots of great, useful information that Alexandra has created and updates regularly. And here's my email and phone number. So I'll stop here and see what questions there are.
So, would you name a special needs trust as the beneficiary of a survivor benefit plan?
Uh, Not usually, although that's a question really for an attorney. Karen, do you have a specific plan already um, created? You can unmute if you want to answer that. Um,
Can you move funds from a Coverdell ESA to 529 to an S special needs trust?
is that a if that's a 529 account? Yes, you can roll it over. I'm not familiar with what Coverdale ESA is, but you certainly, once it's in a 529, you can roll over.
If an ABLE account is close to the max, can the account holder transfer money into their special needs trust to avoid going over the limit? Are there any tax implications to doing that?
Yes, you can certainly transfer. There might be some tax implications if you end up with what's it called? Capital gains. So yeah, I think there are some tax implications, yes.
Is it correct that you can only have one CalABLE account, so a relative cannot open a separate account?
That is absolutely correct. And that's different than the 529 accounts. So remember with CalABLE, it's only one account per holder social security number.
Um, Velvet King, who wants to know,
Hi, Velvet.
did she already speak on what's going on with Social Security? Sorry, she was late.
A little bit. I mean, there's not that many changes that are going to impact people with SSI. So that's the good news. And there's no field offices closing right now in California. There was a list of all the field offices that are closing for the balance of 2025, and there was no California locations on that list. Now, that could change, but for now, there's no changes.
Dolly wants to know, can we share the slides with anyone? I know a few parents who could use this information. Yes, we're fine with you sharing them to whoever you think might benefit. We also do these presentations somewhat regularly. Our next one will probably be in July. So if you want to direct anyone to our mailing list, to our website, they can also come and then they can get some of their own questions asked if that's helpful. Um, Karen answered about her earlier question that it's a military retirement.
So yeah, I don't know. I know that's a good question um, to ask. I forget who it's called. There's a person that oversees government benefits. I know at each base, and I know there's a way of finding out what is eligible and what is not. And also, I know that the military has added like some new family support functions because we've been talking to a few of those families who've gotten that additional benefit.
Can we roll 529 funds to enable account?
Yes. So if you, let's say your kid was born and you were a good parent and you planned ahead and you opened up a 529 account, and then later on they get diagnosed with a disability. Yes, you are able to roll over those 529 account funds into a able account. But the same calendar limits would apply. So whatever the IRS tax exemption is in that calendar year, which right now in 2025, that's 19,000. That would be the max you could cap out in rolling over money.
This is kind of a mechanics of special needs trust question. How does the person for who the special needs trust is made, that's the beneficiary, receive money when they need it? Who manages their account to know if the money they are asking for is appropriate?
So with every special needs trust, whether it's with a bank, with a lawyer or with a pool trust like we have, there has to be a trustee who has it's called absolute discretion under the law. So a trustee has to make the final determination if you can pull out the money and use it for various purposes. So what we do to make it easy for our clients is we create spending plans. So lots of our clients, as we talked about, have recurring expenses every month. We all do, right? You got to pay your cell phone, you got to pay your rent, you got to pay your internet. So those just become very like auto pay. Those become auto paid from your trust, either with a check that gets cut and mailed, electronic fund payment, or using that TrueLink debit card. And then let's say you want to buy a bed or another big piece of furniture. So you would go online or go to a Living Spaces store, take some pictures, and then send the screenshots to your assigned representative. And then the trustee would ultimately say yes or no. Most of the time, we're going to say yes. Sometimes people are asking for stuff that is going to eat up most of their trust fund. So we might say, let's say the example with the bed, they want to buy a bed and they only have $20,000 left in their account and they want to use 10,000 of it to buy a really cool bed. We might say, we understand you need a new bed. Why don't you look for a bed that costs less, let's say between 2,000 and 3,000 or 2,000 and 4,000. So we definitely try to work with clients so they get what they need. But we, at the same time, we have this fiduciary, which is a very high legal responsibility to make sure their funds are being spent in a responsible manner, that it's not in contradiction to any state or federal law.
What is the minimum to get involved with a pooled special needs trust?
So for parents who want to plan ahead, we have that future funded option. And that's a $600 one-time enrollment fee plus another $200 deposit into a money market account at Schwab. And that way you have a completely legal, established special needs trust. Um, you'll excuse my cup that has mint leaves in it. Imagine it's empty. So you create this empty vessel, and then at some later point, you're literally going to pour in liquid assets. So, and for most of our families, the kind of assets that get poured into a special needs trust, it's going to be things like a life insurance policy, IRA money, 401k money, brokerage accounts. Sometimes if the parents like worked for the county or were teachers, there could be pension money. So those are the kind of funds that would get poured into the future funded account. And then once it reaches $20,000, then it becomes an active account and we can begin to disperse funds from that account. So below 20,000, we don't want to disperse money. We want to just let that money sit there, because once it's 20,000, we disperse money, we charge annual fees. TrueLink starts charging an investment fee. So that's why we have that $20,000 tipping point.
$20,000 is the account minimum for an active trust, though.
And let me just grab our website because it's really got so much terrific information. There we go. One sec. Let me just get back in. So here is our website, jlatrust.org. Here's our page about why special needs trust. And we got one of our great moms here explaining why she set up one for her son. Um, and then we have a great page on the types of trusts that explain the differences between what's a first party trust, third party trust, and then the future funded trust. And I know everybody always wants to know about costs and fees. We don't make you call up to get a quote. We have a page that, if we need to update it, we update it. But, everything is just spelled out right here on this page.
Um, Elaine wants your contact information that is in the slides that you'll get tomorrow. Um, but I bet
I'll
Michelle's
put I'll
typing
put
her
it in.
email address right now.
Thank you.
What is an ideal time to create a special needs trust?
That's a good question. Some parents of younger kids, they'll say, I don't know, maybe he'll be able to, be a computer programmer. Maybe he'll be able to have a great job. Maybe he won't need government benefits. And that's a great point. So, I think you can wait for in most cases until the children, are out of high school, and you have a better idea of what their earning potential is going to be. Because the big question is, are they going to need SSI or SSDI or Medi-Cal? Or, like I said, are they going to be able to be uh, an amazing artist or musician or computer programmer and earn, a lot of money? But, there's no harm setting up the CalABLE account.
More questions about the fees. So I'm just going to open up this page again. This is available on our website, um, under enroll costs and fees if you want to go look at it yourself. We charge an enrollment fee and which is flat. It's $1,300 for everybody. And then after that, we charge annual fees. And it's a little complicated because we do charge based on the amount in the account, so it does vary. So it's as low as 1,800 and it can go up.
Or
I mean,
800.
but the answer is it depends. The other thing is we have our partner charges a small fee as well. Um, Most of the time in good financial years, which not every year is, but the investment income from trusts actually covers the fees. But not a guarantee. The market's wishy-washy. Sometimes it totally does. The last 4, 5 years, most of it but not all of the time. Um,
Um, the fee, our fee schedule link. I think it's taking people to the joinder instead of the fee schedule.
oh, does it?
We'll fix that. We'll fix that.
Yep, I will.
But in the meantime, you can certainly look at the web page we have.
I do think the fee schedule link works for me, but maybe I'm.
It's broken, Alex. I tried.
Okay, it could sometimes that happens. We apologize and we'll get it fixed.
Um, the link
No,
here.
not the website link. When you open up the page and you go down
Yeah,
to your
but for me, when I click, it goes straight to the fee schedule.
when I download, oh yeah, there is the fee schedule. It might be in that case, it might be your browser. It works with Chrome.
While I'm on the website, I just want to say we have some other presentations coming up. Um, they're all here on our webinars page. We have two sort of financial presentations coming up. This first one in April is more for like a trust client, like budgeting for the perspective of a person with disabilities. We're gonna invite some of our clients, but anyone can come. Annie is really good at like putting budgeting in a digestible format for a person with a disability who's usually on a smaller budget. We also have this one, which is more financial planning for a parent of a person with disabilities. So our presenter works in life insurance, and life insurances can be a really good way to fund a special needs trust. So that one, you can come to either, but that's who they're targeting. We also, I don't know if this applies to anyone in this meeting, but maybe if you're a professional, are going to be offering this presentation in Spanish in June. So that's what's coming up. We also do, like I said, this one regularly. So if you sign up for our mailing list, it's down at the bottom here. You can stay updated if you'd like to come back. I know some of you like to come back several times, and it's complicated material, so I totally understand why you might want to hear it more than once.
Thank you so much. And thank you, Carol, for the kind words. I did not pay her to say that. So thank you. I appreciate that. Yeah. So I mean, part of part of the reason why I think this is a little more understandable is I'm also a parent, and as I said, we're professional fiduciaries. We're not attorneys. So when you go see your trust and estate attorney, it's a different, it's through a very much a legal lens. And also a lot of trust and estate attorneys, they don't know much about government benefits because a lot of government benefits are seen as for low income people, and trust and estate attorney people tend to work with people with more assets. But yeah, government benefits are quite a maze, and we're, I think we're all dealing with a lot of scary and unknown changes in the months ahead. And we're just going to all have to, row together and get through this. Thank you so much for coming, and have a great afternoon. Enjoy spring. And you're welcome to, the best way to reach me if you want to set up a phone call or a Zoom would be to email me so I can schedule it.
And like I said, I will be emailing out the slides and also a recording to everybody tomorrow. So if you're signed up, you'll get it. And yes, welcome to pass on our slides to anyone you think they might benefit.
Thanks, everybody.
Bye.